CorrectRx is a national leader in correctional and clinical pharmacy services headquartered in Hanover, Maryland. CorrectRx was founded in 2003 by 3 pharmacists and has been providing services for over 20 years. They currently furnish services to over 200,000 incarcerated patients in over 400 correctional and juvenile facilities. CorrectRx's unique corporate vision is based on the practice of clinical pharmacy, collaborating with interdisciplinary healthcare teams to manage a patient's health rather than strictly filling prescriptions.
Our unique company vision is based on the practice of clinical pharmacy, collaborating with the healthcare teams. CorrectRx's clinical programming have been developed, implemented, and proven to improve quality in healthcare over the last 20 years. We see incarceration as temporary and not a label. Our patients are socioeconomically disadvantaged, marginalized, and forgotten by most. Often they have had unmet behavioral health needs in the community. Our patients, while incarcerated, are protected and have rights to health care. We don't ask why they're incarcerated, but we are centered on how and what care they need.
My name's Jean Lee.
My name's Dominique Azari.
I'm Cheryl Wonkwa.
My name is Alyssa Reese.
I'm Faustina Amoa.
I'm Charles Livingston.
And we're the Maryland team.
As clinical pharmacists, we collaborate with providers and nurses in several capacities. Just to mention a few, we round weekly on patients in the infirmary, respond to medication management consults, and perform clinical initiatives, in addition to chairing regional P&T meetings. We also serve as members on multidisciplinary panels such as chronic pain management and HIV hepatitis C.
Seeing patients in the correctional setting presents a unique set of challenges, but ultimately is rewarding. For example, when we're treating our diabetic patients, we have to consider that their food choices and ability to have recreational time are determined by the prison facilities. This provides a unique opportunity for us as pharmacists to be creative with lifestyle and diet changes when counseling our patients.
Just like any other health system, state correctional health systems are budget and quality conscious. CorrectRx clinical program has spearheaded hepatitis C treatment and have maintained utilization and outcomes data to help secure the state's budget for Hep C for almost 20 years. Partnering with the state, community, and correctional stakeholders, our data serves as a historical record for continued public health projects related to managing hepatitis C in Maryland. Our data management and outcomes analysis have been greatly aided by our partnership with the University of Maryland School of Pharmacy. CorrectRx Pharmacy sponsors the Ellen H. Yanklo Health Outcomes Research Fellowship Program at the school. This partnership provides the opportunity for training and the application of this field of study to impact real-life, state-level decisions.
Working in corrections is not for everyone. It is a calling. It's a calling to make a difference in the lives of incarcerated patients who don't have the luxury to go to the nearest CVS or the urgent care to access their healthcare needs. What drives me every day is the impact I make and the change I see with every patient encounter.
I'm Rachel Legg. I have the unique opportunity of serving the female population in the Delaware prison system. A highlight of the work that I do is the integral position that I have on the multidisciplinary care team and fulfilling a professional goal of mine of serving the underserved.
Hi, I'm Lisa Kiki. I'm a clinical pharmacist in Delaware and lead the statewide diabetes initiative. In addition to being both certified diabetes manager and certified diabetes care and education specialist, I'm also a nurse with previous correction experience. My unique experience helps me navigate creative ways to provide pharmaceutical care and connect with patients. The most important thing for me is for my patients to understand that I see them, that I care, and I am here to work with them to achieve the best outcome.
And I'm Jamie McGee. I have the privilege of working with our geriatric population and our substance use disorder population.
Georgia, the 4th largest correctional system in the country, trusted that clinical pharmacy would make an impact on this vulnerable patient population. We started by learning Georgia's correctional healthcare structure. Combined with our knowledge in other systems, we were then able to build and deploy clinical pharmacy programs specific to Georgia's needs. CorrectRx has implemented key system-wide services, such as clinical pharmacist-directed prior authorization, antimicrobial stewardship, and polypharmacy reviews. The results our clinical pharmacists produce has expanded acceptance of these programs. Our successes continue to push other correctional systems away from dispensing only pharmacy towards a model that values clinical pharmacy benefits to overall population health.
And we're the national team. On the national clinical team, we work with a multifarious patient population in facilities nationwide, ranging from rural county jails to large prisons. Our patients come from a myriad of backgrounds, many of whom have never received any medical care.
We work with each facility's medical and non-medical leadership to provide the most contemporary and comprehensive medical care, advising on medication selection, treatment clinical pathways, and regulatory affairs.
We provide consultations on high acuity patients, medication reviews for juvenile sites, and formulary management.
CorrectRx is honored to be publicly recognized with the Pinnacle Award for our innovative and advanced clinical pharmacy programs. CorrectRx has been a pioneer for over 20 years in promoting the role of clinical pharmacists in the correctional healthcare arena. I am particularly proud of our highly dedicated and credentialed pharmacists who have implemented very sophisticated and complex programs in this non-traditional setting. The Pinnacle Award shines a light on CorrectRx's steadfast commitment to the profession of pharmacy, and it's a wonderful validation of the positive impact we're having on the patients' lives we serve, as well as the public health nationwide. In closing, I would like to express my sincerest gratitude to the APHA for this wonderful honor. Thank you very much.